God morning and good morning. Welcome to another episode of Talking Cancer, My Journey, My Way. What can I say? Like I do every morning, thank God for the wake up. Thank God for the wake up. Thank God for the wake up. Okay, so, yesterday I was talking about how I finally got an option for a clinical trial. Um, Especially with the response to chemo, um, my the first time around. So, and actually, yesterday afternoon, I received my first introduction, basically, to the process, where I received an email talking about what the name of the research study is called. And so this particular trial is called DSP 107-001. It's sponsored by CAR Medical, or that's spelled KAHR. And so the first thing they did was they sent over in consent form and a Health Insurance Portability and Accountability Act form. So this is what they're doing right now. So this is the first process. I got to fill out these forms, but let me go over these forms just a little bit with you. This is going to be the UCSD permission to use personal health information for research. So this particular one says what the purpose of this form is. State and federal privacy laws protect the use and release of your health information. Under these laws, the University of California or your healthcare provider cannot release your health information for research purposes unless you give them permission. So, and then it goes on to say what personal information will be released, which will be my entire medical record. It asks, do I have to give permission? Yes, I do. In order to even participate in the study. So remember, right now this type of thing is lab rat stuff. So for sure, who will discuss and receive my personal information? Um, it says my personal health information may be shared with these people for the following purposes: to do research to the research team for the research described in the attached consent form, to others at UC with authority to oversee the research, and number three, to others who are required by law to review the quality and safety of the research, including U.S. government agencies such as the Food and Drug Administration or Office of Human Research Protection, and research sponsors, CAR Medical Ltd. Or Limited, or the sponsors. Excuse me. So it says, it also asks, how will my personal information be shared for the search? How am I required to sign this document? It says, no. How am I required to sign this document? No, I'm not. But then that disqualifies me from participating in the search, in the research. Does my permission expire? The permission to release your personal health information expires when the research ends and all required study monitoring is over. Can I cancel my permission? You can cancel your permission at any time. You can do this in two ways. You can write to the researcher, or you can ask someone on the research team to give you a form to fill out to cancel your permission. If you cancel your permission, you may no longer be in the research study. So, no matter what, if you want to cancel, you can do so. But again, you release your rights to be in the study any longer. So, no more attempts for, getting rid of this cancer. And that's so the second part that they sent me was part two expansion cohort, part B consent to participate in research, and this kind of gives um, more in depth about the medication. Let me see. So this is they call it protocol number DSP107-001, HRPP number 210033. So when they do their, and you ever see them get their tape recording? Yeah, this is a test sample DSP107-001, day number 2. We are now injecting subject with HRPP 210033. You know what I mean? Stuff you see in the movies for real, man. So the introduction to the second part would be the consent form describes part 2, the expansion cohort B of the research study, and helps you decide if you want to participate. It provides important information about what you will be asked to do during the study, about the risks and benefits of the study, and about the rights and responsibility as a research participant. By signing this form, you are agreeing to participate in this study. It says, I should read and understand the information in the document, including the procedures, risk, and potential benefits. If I have questions about anything in this form, make sure to ask the research team for more information before I agree to participate. You may also want to talk to your family or friends about the participation in this study. Do not agree to participate in this study unless the research team has answered your questions and you decide that you want to be a part of the study. Your participation in this study is entirely voluntary. So they're putting everything in. It seems like in layman's terms, for real. They're not. It's crazy because they use when you go to the doctor, they use all these big and fancy words, but now it's clinical trials. They want to make sure that you get it. So they're going to use the most basic words to make sure that you understand what's about to happen. The lab rat. So it goes on to say this particular part of the is a 21-page document that I need to go over and read and make sure that I understand completely. But I'm gonna go over part of this with you. What is the purpose of this study? The purpose of this study is to examine the safety of DSP107 and to see how well I tolerate it when given alone or together with I'm gonna just say AMOB, okay? Because atezolizumab, AMOB, okay? So when I say AMOB, atezolizumab. So that is a chemo type drug. Okay, just so you know, anything with a mob on the end of it, MAB, is a chemo type drug. So what is the purpose of the study? So one is to examine the safety of DSP107 alone and together with AMOB. Next will be to examine how DSP107 is handled by the body, absorbed in the blood, distributed in the body, broken down and eliminated when given alone or together with AMOB. Other questions that we hope to answer are: what is the effect of DSP107 in the tumor? Does DSP107 affect the way in which AMOB is handled by the body? Does the body develop antibodies, proteins, made in the body that respond to a substance that is foreign to the body against DSP107 or AMOB. What effect does DSP107 when given alone or when given together with AMOB have on the growth of my tumor? DSP107 is considered investigational, which means that it has not been approved by the U.S. Food and Drug Administration. Animal studies have shown that DSP107 can shrink tumors when given alone and when given together with a mouse-specific antibody similar to AMOB. 42 participants in part 1 of this study have received DSP107 with doses ranging from 0.01 to 10 milligrams, either alone or together with AMOB. DSP107 at a dose of 10 milligrams was safe and well tolerated when given alone and together with AMOB. The longest study treatment duration for DSP107 given alone was 6 months in a participant with lung cancer and more than 8 months so far when given in combination with AMOB in a participant with a type of soft tissue cancer. It says, I will receive DSP107 10 milligrams per dose once a week. If I am participating in a combination therapy group, I will receive an approved anti-cancer drug called AMOB once every 3 weeks. The use of AMOB in this study in combination with DSP107 is also investigational. An investigational use is one that has not been approved by the FDA. The study DSP107-001 is divided into 2 parts. Enrollment of participant to part 1 of the study has already been completed. This form refers to part 2, expansion cohort B of the study, during which we will test whether DSP107 is safe, well tolerated, and effective when given alone and in combination with AMOB in participants with cancer of colon or rectum. And then it says study designs and procedures. So this is a lot. This is an open label study, which means that both you and your study doctor will know which study treatment you are receiving. So they will let me know which study I will be receiving. You will be randomly assigned, like the flip of a coin, with an equal chance of being in one of 2 study groups, DSP107 alone or DSP107 in combination with AMOB. I'm not sure if I want the AMOB, but I don't think I have a choice. Well, I have a choice. I could always refuse at the end of the day. But, AMOB and chemo is just one of those things. It just doesn't sit well with me. Let me continue. It says all participants in the study will receive an investigational drug, DSP107. If you are participating in a combination therapy group, you will receive AMOB. In other words, there will be no placebo dummy drug for any participants in this study. The study duration for all participants will be up to approximately 52 weeks, which includes screening period for up to 28 days to allow your study doctor to assess your suitability for enrollment into the study, up to 12 3-week study treatment cycles. Study treatment will be stopped early if you do not respond to study treatment or if the body treatment is not well tolerated. A follow-up period for up to 90 days after your last dose of study drug. The screening assessment says I will be asked to sign this informed consent before undergoing any study-related procedure. Signing this consent form does not mean that you will be able to take part in the study. You will have screening tests to help the study doctor decide if I am eligible to take part. The screening test must be performed over more than one visit to the clinical trial site. The following tests and procedures will be performed within 28 days of the first dose of study drug. Collection of demographic data, medical history, medication history, physical examination, including weight measurements, vital sign measurements, blood pressure, pulse rate, temperature, oxygen levels in the blood, and breathing rate. Eastern Cooperative Oncology Group performance status, a scale that measures how your cancer affects your activities of daily living. 12 lead electrocardiogram, a recording of the electrical activity of your heart. Blood samples of laboratory safety tests, blood count, blood chemistry, and clotting tests will be collected. Blood samples will be collected to measure thyroid hormone levels and female hormone levels in female participants less than 60 years old. Blood tests to check for pre-existing antibodies against DSP107. Blood tests for virus that causes hepatitis B and C, HIV, and if you test positive in one of these diseases, your study doctor may have to inform the public health agency in your county or state. Urine pregnancy tests don't relate to me. Computed tomography, a CT scan, a image produce procedure that uses computer process combinations of many x-rays taken from different angles to produce high resolution, and tumor biopsy. So they're going to have to take another biopsy of the tumor. Removal of a little piece of tumor for microscopic examination, provided it is considered safe by your study doctor. So they already did it once, so they want to go and they do it again. That was kind of painful. I was like, seriously, you go in and take a little piece of the, into the liver and snatch a little piece off. I mean, I don't know why they just don't take off the whole damn thing, but no, it did hurt though. It did. So the baseline assessment, pre-dose day 1 of study treatment, cycle 1. Once I have been confirmed to be eligible to take part, I will be invited to attend a clinical trial site, and the following assessments will be performed before I receive my first dose of study drug. A brief physical examination including weight measurement, vital sign measurement, ECOG performance status, ECG, review of medical history and ongoing medications, collection of blood samples for lab safety tests, confirm eligibility, collect pre-dose samples to measure DSP levels in the blood, level of antibodies against DSP107, binding of DSP107 to its target in the blood, only if I am one of the first 14 participants receiving DSP107 alone, or one of the first 14 participants receiving DSP107 in combination. Cytokine and complement levels in the blood, proteins that are sometimes associated with severe reactions to drugs that affect the human system. potential signs in the blood that can predict how I respond to DSP107, the biomarkers. Measurements of fragments of DNA from the tumor in the bloodstream, measurements of the substance in the blood called I can never get this word, I swear. Carcinoembryonic antigen, or CEA, that can be used to assess response to treatment. If I'm enrolled into a group of participating receiving DSP107 in combination with AMOB, we will also collect pre-dose samples to measure AMOB levels in the blood only if you are one of the first 14 participants receiving DSP107 in combination with AMOB. Levels of antibodies against AMOB in the blood. So I think I'm going to stop right there. So I stopped at page 4. So this is a 21-page documentation, and I'll probably continue just to go over with you, just so you know, these are things that, you're going to have to go through if you happen to participate in a clinical trial drug. Right now, I'm still going over all of this, and I'm choosing to go over it with you, just to kind of get an idea of what it is. And also, maybe I have questions and things like that. So next we'll go over, the study drug administrations and stuff like that. So continuing on to page 5, basically. Yeah, this is interesting, to say the least. So, and I know it's a lot, and I know that they, with the study, we have to cover ourselves, you know what I mean? So I understand what they're doing. And I understand that, the process now has moved on from lab rat to human testing. This is what's happening. So, again, this is not an easy thing for me, as I will continue to have questions. And, as I continue to read, I'm pretty sure these questions will come about, especially reading it over a few times just to make sure that I get a clear understanding of exactly what's going on, and things like that. So thank you for tuning in. I truly appreciate you. My name is Lewis, and you're listening to Talking Cancer, my journey, my way, and that's my time. Peace, love, one.